Okay, the recording has started. So I'm really excited to introduce the Dorset Care Record and Saving Lives project because it's close to my heart, as I was there right at the beginning when we kind of come up with the idea and tried to get it funded because we knew it was the right thing for people receiving health and care in Dorset. So I'm really pleased to welcome Catherine and Tony to talk about Dorset Care Record and Saving Lives. Thanks both.
Thank you.
Thank you very much. Welcome all of you. A very warm welcome. Thank you for having us today. Hope you enjoy the next hour with us. So hope you've got a tea, coffee in hand, relax and hopefully enjoy. So Dorset Care Record and Saving Lives, as we said today with ourselves, Catherine and my colleague Tony. And a little bit about both of us. So I'm Catherine. I'm the training manager for the Dorset Care Record. I've been in post now for about 14 weeks, I think. Feels a lot longer already. So my background was very much film, theatre, TV, media, going back some years and working predominantly in TV and film editorial work. That then led me on to working in local authority services in South Gloucestershire for some years, predominantly delivering film and media projects to children and young people at risk of exclusion or of criminal activity. And then moving forward into the future, more so went into social services, working with children in care, again on media and film projects, and training children and also adults in utilising different media formats and platforms. And that's brought me to where I am today here at the Dorset Care Record. And Tony, over to you.
Thanks, Catherine. So I'm Tony McDougal. I've been working on the Dorset Care Record on and off for the last sort of 3 years. And I started as an agricultural journalist, working for the Western Morning News, Farmers Weekly, Farmers Guardian. And then 2001 got poached by DEFRA during the foot and mouth outbreak to work for them. So worked in a variety of comms and marketing and PR roles for about 14 years, and then came back down to Dorset and have been working here in health comms for 3.5 years. So it's great to be here, and we look forward to sharing a bit more in a sec.
Thank you, Tony. Okay, so what's on the agenda today? So we're going to kick off with Tony. He's going to take us through the journey so far with the Dorset Care Record, a bit of the history and where we are today. I'm then going to take you on a little bit of a whistle-stop tour of the system and how it is currently, which then neatly takes us on to training, mandatory training specifically, the review that we've conducted and where we are now with that training. Tony's then going to talk you through some interesting case studies of how people are using the system to great effect. And finally, a little glimpse into the future and the citizen portal. So if you've got any questions at all, as we said, pop them into the comments bar on the right hand side. Mics are all turned off anyway. Well done, you lot. And we'll begin. So we're going to start off with just going to stick a link into the comments section, which is going to take you to a notice board online. And we're just interested to hear a little bit from you about what prompted you to come along today. Perhaps what are you hoping to learn from the session? So if you click the link, it should take you to this particular page here. I'm going to give you a few seconds to click onto that, and I'm hoping by the power of modern technology that all works okay for us this morning. Great, that's the first comment through. I'd love to know more about the impact DCR is having. Thank you. It might be a little bit slow coming through. So we'll do a bit of a refresh on the page and see if we've got any more coming up. There we are. To hear the case studies. There we are, Tony.
Oh, well, there you go. They answer both those, I think. I hope so, anyway.
There's a few other people typing at the moment, so hopefully we'll see some more populated in the next few moments. It is one of those times you need background music, isn't it? Great, really lovely to hear more about the Citizen Portal. Tony, that's one for you again, and what it can do for Dorset. Fab.
No pressure.
None at all. Looking at how it's helping support Dorset Council and the citizens of Dorset, and to see how it compares with EPR in BNSSG.
So that's the Connecting Care project, isn't it, in Bristol? Well, we're a little bit behind them. Bristol are up to, Bristol started about 2 years earlier than us, and they are about, I think it's about 60,000 records being shared on a monthly basis, and they are going great guns. So we're a little bit behind them at the moment, but they were in a similar position to where we are now 2 years ago. So, you know, very, very similar trajectory, hopefully, for us.
Okay, wonderful. I think that's a great start. Thank you so much for participating in that. So I'm going to pass you over to Tony now. Tony, over to you.
So we're going to have a video in a second, and this video was done by our marketing consultancy, Cammack Davies Fleming, and basically it charts the journey of patients. And prior to kind of DCR, sometimes the journey isn't that smooth because records aren't being shared. But let's have a look at this.
When you're planning a journey, you want to go from A to B. This may involve taxis, trains, an airport, before you arrive at your destination. But although several different organisations are involved, you still progress from your starting point to the finish reasonably smoothly. Sometimes this doesn't happen with health and social care, which is more a journey from A to Z via all the letters of the alphabet, having to repeat your story at every step along the way. How frustrating is that? For example, you might arrive at accident and emergency. Each time you remember the same story over and over again. Or you're discharged from hospital, but the information about your history, diagnosis and treatment is not sent to the care home or the community nurse by the time you arrive. This is where Dorset Care Record kicks in. A permanent and readily updated record containing all your health and social care details, allowing medical and social care staff to give you the best possible care.
Dorset Care Record is a new confidential computer system that will merge records from different sources to create an accurate record about you. Over time, this will allow us to improve the care you receive.
The sort of information Dorset Care Record will provide includes up-to-date personal contact details, next of kin, diagnosed conditions, medications, allergies, test results, referral clinic letters, and discharge information. So, whatever the situation in which you find yourself, whenever you need to call upon Dorset's medical and social care resources, having your medical and social care history to hand will allow appropriate professionals to decide more quickly on the best course of treatment and the best way to help and care for you. Dorset Care Record is a partnership supported by every major healthcare organisation in the county, so you can see how important it is for the well-being of our community. Everyone will have a Dorset Care Record unless you choose to fully opt out. If you're happy to have your details included, you don't have to do anything. It will happen automatically. But if you want to opt out, you can. You'll find leaflets with full information in your local library, sports centre, council offices, doctors' surgeries and hospitals. You can also log on to our website or call our helpline on 0345 200 0026.
So I'm going to run through a little bit of history around the healthcare records and where we are now with the Dorset Care Record. So doctors have been documenting patient health since at least 3000 BC, the approximate date of ancient Egyptian hieroglyphs that depict the practice of keeping medical records. However, medical records weren't steadily used until the early 1900s. And prior to the 1960s, all medical records all over the world were kept on paper and in manual filing systems. So things like diagnosis and lab reports and visit notes and medication directions were all written and maintained using sheets of paper bound together in a patient's medical record. In the Western world, in the mid-1960s, Lockheed developed an electronic system known then as a clinical information system. And the rest really is history. Other technology and engineering companies started to develop electronic medical records. The US federal government started to use them for veterans coming back from the Vietnam War in the early 1970s. But these systems existed on large mainframe computers, and their primary purpose was to facilitate research and improve medical care. By the early 1990s, digital record keeping began to spread and computer hardware became much more affordable, powerful and compact. The internet provided faster and easier information, and there were local area networks, and there were the first web-based EHRs. But it wasn't a success story straight away. In the US, widespread use of EHRs was delayed by high costs, data entry errors, lack of interest from physicians, and the feeling that there was no real incentives. Digitalising records at the time was seen as really expensive. In the UK in 2005, the NHS deployed EHRs in NHS trusts with a goal of having all patients with a centralised electronic health record by 2010. Unfortunately, it failed, and it failed pretty spectacularly. The Lorenzo patient record systems were adopted in a number of trusts, but while record systems were established, there was no national healthcare information exchange. Ultimately, the programme was dismantled at a cost of £12 billion pounds. It's one of the most expensive healthcare IT failures on record. Arguably, the only good thing to come out of it was the introduction of GP summary care records. But the publication by the Department of Health Care Act was a new attempt to integrate patient records, and it stated that every citizen would be able securely to access their health records online by 2018 and make real-time data available to paramedics, doctors and nurses. So what's happened and where does the DCR fit in? Well, as you can see, we're not quite there yet. We haven't met the 2018 deadline, but we've made good strides forward in Dorset. And that's partly due to a bottom-up approach, allowing counties to lead rather than having a top-down Whitehall-centric approach. I think we've been hearing something similar about that at the moment. As part of Dorset's Sustainability and Transformation Plan, the need was identified for staff across care settings to have access to a more holistic view of the current stats of a person's health and care, improving their ability to make informed decisions about their treatment. Too much info was in silos that really couldn't be accessed. And so the DCR programme was born to deliver an integrated digital record, and records were, as we've heard, already up and running in Bristol and neighbouring Hampshire. Hampshire's got the oldest care record. It's been going for about 18, 19 years. We chose in April 2017 Orion Health's Amadeus Open platform to provide the technology behind the DCR partnership. And I just wanted to say a little bit about the partnership. So it involves Dorset CCG and all the 81 GP practices, Dorset County Hospital, the newly formed United Hospitals Dorset, which encompasses RBCH and Poole Hospitals, Dorset Healthcare covering community and mental health, and the two councils here in Dorset and Bournemouth, Christchurch and Poole. And at the heart of the DCR is the DISC, which is the Dorset Information Sharing Charter, which makes information sharing across this large group of organisations possible. So what was the challenge? Well, the lack of a single view of information could lead to inefficiencies in the system, delayed transfers of care, unnecessary emergency admissions, duplicated tests, and clinicians having to make care decisions without a full view of a citizen's situation. Information was not always in real time, and seeking citizen information held at other organisations could be really time consuming or sometimes impossible for clinicians, particularly during evenings or the weekends. So what was the solution? The Dorset Care Record has taken a phased implementation based on regular releases of additional data and functionality. And for the techies out there, DCR is cloud-based with hosting provided by RedCentric. Patient record matching is done through an interface between the Orion Health platform and NextGate's Enterprise Master Patient Index, the MPI, and demonstrating that our commitment to interoperability, the system uses SNOMED, READ, DM+D, HTML, ITK, HL7 and HL7 FHIR standards. So next slide, please. So the first iteration of the Dorset Care Record went live in February 2018, and this included all the demographic data from the county's 3 acute hospitals. That involves date of birth, address, next of kin, NHS number and ethnicity. And it also contained GP records covering diagnosis, events, examinations, investigations, medications, allergies and other things. And since then, we've introduced alerts and encounters, radiology and pathology reports and referrals, discharge medications, clinical correspondence from our acute hospitals, adults and children's demographics from the local authorities, and sign-on for most of the partners. And that really allows easy access straight to the DCR from their system. So obviously, we've had COVID still looming large. And this year, as a result, we've done a couple of additional things. So we've introduced the DCR to Yeovil Hospital over the border in Somerset, enabling clinicians and staff to deal more quickly with the 30 to 40% of patients from Dorset that they receive. They no longer have to ring up GPs in the north of the county for records, so that's obviously saving time. We've also rolled out the DCR to 150 community pharmacies this year, helping support the long-term plan of greater integration of community pharmacies in the local health and social care system. And we've been working closely with the local pharmaceutical society and the national PSNC organisation. So all that has contributed to a steep growth in usage, which is really encouraging. We're up to 14, as you can see, we're up to 14,000 records a month accessed. And this time last year, we were at 3,000 to 4,000. So we're seeing a growth rate consistent month on month of between 6 and 8%. And we now have nearly 2,000 health professionals trained to use a DCR. Next slide, please. So how do you and I benefit from the DCR? Well, over the past 3 years, we've run around 230 engagement events across the county and further afield. And first of all, the overwhelming majority of people are firstly amazed that this doesn't happen already. Secondly, they're very happy to share their record with their nurse, their hospital consultant, and particularly their GP. And thirdly, they're still not so happy to share with social care. They're sadly not so supportive of social workers, but they get confused with social services and benefits. But people are happy to learn some of the benefits, that you only have to tell your story once. There's greater coordination and safer care, that your record is always available to those involved in your care. And as a result, professionals understand your situation better. Next slide, please. And people who use the DCR, according to our analysis and evaluation, find it particularly useful. They find it simple, easier to understand, useful, great achievement, saves time, which is great. And we obviously continue to carry out evaluation. And now over to Catherine.
Thank you, Tony. So now I'm going to take you on a short whistle-stop tour of the DCR system. Bear with me, I'm going to pull that one up and bring it over to your main screen. Okay, so you should now be able to see our Dorset Care Record system. This is the test system which we use. So this is where we search for a person. You can either search by the NHS number or through other identifiers, or through demographic details such as a surname or a forename and a date of birth. So there are other options too, but of course with single sign-on, which is now on board for all but 2 of the partners, this means that this is becoming more and more redundant, and increasingly people are logging on through their own systems. So with Dorset County Hospital, they're logging on through their digital patient record. So we're going to search for the other identifier, which is a number that we use for some of our test patients here. And you'll see that we've come across a Ms. Narrow-Wide. She's 52 years old and surprisingly lives at Dorset County Hospital. So you'll see then within the patient banner, you'll find demographic information, including date of birth, gender, address, GP practice. And under that, there's a line including summary details, patient task list, medications viewer, and citizen portal. So you want to find out with this patient whether there's been a discussion for a health and social care practitioner to allow them to view the person's record, which of course is something that needs to happen for every patient. And under the more relaxed discussion to view arrangement, this ideally should happen during conversations at GP practice or on a routine social work visit, rather than in an acute sitting when the patient's about to receive treatment. And in this case, we can see that Sarah Moore recorded this on the 22nd of August, and that Ms. Narrow-Wide was happy for her shared record to be viewed by people directly involved with her care. It has been completed, and so the practitioner knows that another discussion is not necessary at this time. Now, if we go back to recently accessed, we're now going to pick another one of our test patients, Patricia Dodd. So Patricia Dodd is a 63-year-old female, and if we click here, we can see a GP summary. This isn't the full summary care record, but more of a snapshot, and it's important to note this will only be as up to date as the source GP system. For example, if the GP is still waiting for some clinical correspondence or the practice has not captured the information in the system, it will not be available in the Dorset Care Record. And people say to us they find it's really useful to have the acute and repeat medication all together, as well as the allergies and adverse reactions and recent tests. And it's fairly intuitive. It lists the current problems in a historic format with the most recent at the top. Now on to Miss Buzzy Gula, another one of our tests, to have a little look at what pathology looks like on the system. So if we go back to the summary care, summaries, click onto pathology, and we can see apologies, we're having some difficulties clicking that one on. Now, the reason we're having difficulties is because I've clicked the wrong test patient. So if we look here, we can see the options here. We've got blood bank, chemistry, haematology, microbiology and virology. In this particular case, we're going to have chemistry, and in particular, some results for urea and electrolytes from the 15th of October. So you can change the order that you view these. This can be done by title, date or author, or viewed in category type. This has been really useful for people wanting to get blood test results from GP practices, and can also be viewed as cumulative graphs as well. And then finally, if we look at one of our final test patients, Ms. Buzzy Gula, we can have a look at the medications viewer. So medications viewer provides the ability to view and search a person's medication history. Please be aware, though, that the details displayed in each column are dependent on the production data provided by the JAC source system, and the list of discharged medications on the medications viewer is sorted by the date the information has been fed into the Dorset Care Record. So you can see the medication, its description, dosage, form, strength and strength units, the route, oral or topical, the start and stop date, the day supply, prescribed date, instructions for taking meds, supply quantity, and whether the medication should be continued by the GP. So that's very much a whistle-stop tour of the system as it is today. So moving on from that, we talked about discussion to view. Mandatory training is one of the ways in which we ensure this is covered. Now, one of the first tasks that I had to undertake within my role was to actually explore the effectiveness of our current mandatory training. All professionals seeking a user licence to the DCR must first undertake our information sharing and security mandatory training module, and the assessment also, which is delivered by the Project Management Office. So we have a total of 7,500 user licences, and currently we have around 2,000 which are in use as a result of undertaking our training. So originally, the Dorset Care Record was sent as the lawful basis for processing data. However, after consultation with the Information Commissioner's Office, we revised that, given the project already started pre-GDPR on this consent discussion to view basis, this would require detailed comms and training to professionals to equip them to have this conversation. So in order to support that change, the ICO advised a few things that the DCR should undertake, and we did the following. So informing all residents in Dorset of this change. So with Royal Mail, we delivered leaflets to 342,500 homes, covering 770,000 people across Dorset and also the BCP area. It was also demanded that we provide formal training for all DCR users, which is the mandatory training as it is today, and ensure that there's a way of recording discussion to view in DCR, which is also included within the mandatory training. So training is considered one of the most used mitigations against risk in the project, and it's considered to have been measurably developed with the evidence of user completion. So the e-learning was being accessed via Dorset Learning Online. This is the online e-learning platform which we've been using with Dorset Council. And it's estimated the user to take between 40 to 60 minutes to complete, and was around 47 slides in length, as well as the compulsory 10-question assessment, which the participant must have achieved a pass rate of 80% in order to be provided with a user licence. So pre-COVID, the training was also delivered in classrooms, and more recently as webinars, and all training is designed and delivered by the Project Management Office. So there was lots of positive feedback in relation to the content and the usefulness of the e-learning and the delivery of webinars and classroom training, particularly from professionals who otherwise don't regularly access similar systems as part of their day-to-day tasks. Delegates relayed information was clear, it was understandable and easy to navigate. However, These comments risked being lost within the returning negative messages, which were concerned predominantly around the overall length of training. It was repeatedly being reported as a challenge to fit into very limited weekly admin time, particularly for those working in primary healthcare, acute and ED, and this alone was creating a barrier to access. It was also being questioned by our partners whether the content of the training was entirely needed, rather it was feeling repetitive to that of partner organisation in-house IG mandatory training, and also those gaining access via single sign-on. So an assessment of all of that led us to the understanding that whilst there is much positive feedback from users who were valuing the training, there were also those opposed to it, and those that feel that information immaturity perhaps might be repetitive of other IG compliance training they're required to undertake. There were also clearly frustrations about how one accesses the training through Dorset Learning Online, which at times was difficult to find within the platform, and sometimes the overall number of slides would become limiting as well. So where did we go from here? So one of the big recommendations that we had to be put forward was we needed to review the current length and the content of the mandatory training, and to ensure that it only includes the very essential information as advised by the ICO, and that which is relevant specifically to DCR, which is discussion to view, opting out and understanding records. We also began to understand that we really needed to begin using the full functionality of Articulate 360, which is the software we use for our e-learning, to really try and create effective training materials that would help increase engagement through system walkthroughs and more audio and visual aids, both within the e-learning environment and continued webinars. And also to consider the use of the closed YouTube channel to help with referencing as well, and short how-to videos. And finally, to perform a review of the prominence of the training within Learning Online. And in line with all of this, whilst we have led webinars and classroom learning, and they've proven to be effective, it's now time to decide whether we can safely permit authorised training leads to also cover the training within their own organisational induction training. So all of this was digested. We went away and had a good hard think about how we could improve this for our partners, how we could really try and increase engagement. And we're pleased to say that from September of this year, we have begun delivering what we call Mandatory Training 2.0. We have reduced it massively in length. So where it was 47 slides in length, it's now only 7. That includes an introduction and the end pages. So I'm going to show you where that sits and how we've changed where it is in the system today. So I pull this page back over and I'm going to show you. So instead of using the e-learning platform, which meant that individuals were having to log into e-learning online, we now house all of our e-learning modules within our Dorset Care Record staff web pages. And in here, we've got the mandatory module with a link for anyone to access it, plus all of the optional additional modules, which we'll obviously add to as the system develops and increases. Alongside that, we've also got a quick reference page so that everything's housed in one area. We have a variety of online resources. Again, this is a growing and very much evolving. And we've started to introduce YouTube videos as well, very much short, snappy ones that very specifically address certain key areas that the user might want to just have a bit of further understanding on how to access. So we've begun that by putting through some short ones about recording discussion to view and viewing sensitive records, both of which help to facilitate the mandatory training. So what does the mandatory training now look like? So the mandatory training now is more visual, as we've said. We've really reduced the amount of slides and we're now focusing on 3 key areas. So this really just takes the user through a very quick but information specific tour of what's required for the assessment in order to gain a user license. So relaying the information around understanding why one doesn't need to ask for consent, understanding that public task is now the lawful basis for processing data. We're also now trying to utilise Articulate 360's software as much as we can in terms of making it more interactive and engaging. And this was very much around explaining how a discussion to view takes place and also showing how the individual goes on a journey with us. Some vital information here about opting out. What is opting out? How I deal with opting out, where I can get opting out forms from, and what it means to opt out, and how that will or will not impact on the summary care record, because there's obviously a bit of confusion sometimes and a misunderstanding between what the two are and what it means if you opted out with one but not the other. And all along the way, always signposting the individual back to our quick referencing guides on our staff website pages. And then finally, some further information around what a sensitive record is. But understanding if it's marked as sensitive, that's used to protect the location of vulnerable patients. It's not about those that have opted out. And some further information to support it. And finally, talking with our partners, they also thought it was important that we still continue to include some information around the importance of audit trails and breaches of information and what that means, and that they said there was no harm in reinforcing it within this training as well as their own. So we've ensured that we concluded this just as one final slide. So that really is it then for the training and where it is today for the mandatory training. And then there's a link directly to the assessment at the end. The assessment's now only 5 questions long, but we do ask for a 100% pass rate. So moving on, where we're at now, we've started a pilot rollout with Dorset County Hospital, which I'm pleased to say they're now including within their own in-house training for all of their clinicians coming through, and they're delivering it one-to-one as well. As time goes on, we'll continue to feed that back with our training group. It's very much an evolving beast. We're learning as we go, and we be able to do more of this with more of our partners as time goes on. And that's everything where we are today. Thank you very much. I'll pass you on to Tony.
Thank you, Catherine. And I think that just shows how useful new technology in Articulate 360 is in terms of making it much easier for professionals to be able to understand and complete the training. We're very keen on practitioner case studies, and we have about between 30 and 40 on our website. And I wanted to pick out 4 briefly, showing how data saves lives. So firstly, I want to take Natalie Harper. Natalie is a respiratory nurse consultant at Dorset County Hospital. She's a frequent user of the DCR and finds it useful as patients often forget exactly what medications they are on for asthma and other long-term lung conditions. But in this instance, the story is around safeguarding. So Natalie said the DCR had flagged up a safeguarding issue, and this is her quotes. "I had a new referral from a GP practice, a young person who had recently moved into the area. Nothing was highlighted on the referral, but the GP summary information on the Dorset Care Record flagged up a possible issue of domestic abuse. This rang alarm bells, and then I had a phone call from a member of the public who said, oh, please use this number, my number, when ringing for the consultation for this person. She then contacted the referred person's former GP surgery, which highlighted potential issues. So steps were taken to ensure that the person can now talk in a safe environment, and they were particularly grateful. So additional information helps protect lives, this instance from abuse." Next slide, please. This is Paul Murray. He's one of the largest users of the DCR at Dorset County Hospital, where he's a renal specialist. And Paul sees around a dozen patients at each of his 4 or 5 clinics a week at Dorchester, and also spends sessions at Poole Dialysis Centre. He oversees 100 patients receiving blood dialysis. He says the Dorset Care Record is providing real benefits in his day-to-day work. Having ease of access to see current and repeat prescriptions is extremely useful. People often remember to bring their prescriptions to our clinics, but sometimes they bring piles of paper dating back years. Often when asked, people will say their doctors say their blood pressure is okay, but what is okay to some may be different for me. So Paul adds that patients coming to him pre-dialysis are offered vaccination against the hepatitis B virus, and you'll see the quote here. The problem we've had in the past is what has happened regarding patient vaccination history and whether the immunisation has worked. Dorset Care Record enables me to see when and which vaccine they've had. Very useful, as patients understandably tend not to have a clear recollection. So this is an example of how the DCR is making a difference in terms of the quality of care and service provided by specialists like Paul. So no slide for this next one, but I wanted to raise it as our clinical commissioning information officer, Anna Coslet, felt that in this instance, the DCR had saved a man's life. He's a middle-aged man we're talking about. He has complex learning difficulties, a history of alcohol dependency, and a form of psychosis. And in the past, he'd often presented himself to hospitals saying he had had something in his heart or something was trying to get out of his stomach. Anna said she had noticed that the man also exhibited very high cholesterol levels. So she quotes, "We managed with his GP to add this information to the man's summary care record, which feeds into the Dorset Care Record. We said that he should be physically examined before being discharged if he presented himself again at hospital." And sure enough, the man did present himself at hospital, and the first consultant, who didn't have access, sadly, to the DCR, referred him to a psychiatrist on mental health grounds. The second consultant looked on his Dorset Care Record and, after tests, realised he'd actually already suffered a heart attack and was in grave danger of having another one imminently. He was treated as an emergency patient in Dorchester and later recovered and was discharged. Next slide, please. It's not all about life-saving. Sometimes it's about just improving the quality of someone's life at home, ensuring that someone doesn't need to go into care or hospital, but can be helped. And this person is literally showered with help. So we're talking about an 84-year-old gentleman becoming dizzy in the shower, having problems standing up. He wanted a seat to have in the shower, but the computer said no, he didn't meet the eligibility criteria. But the DCR showed that he was on some medication, which meant he was in fact eligible and was provided with the equipment he needed. So that's just a small example. Next slide, please. And so a little bit about the future. The personal health record that you and me can use. For us, it's going to be called Dorset Care Record, and we're aiming to have 3 pilots launching soon. So NHS Digital is actively promoting the use of universally available electronic personal health records, so PHRs, for citizens, and their availability is supported in the NHS long-term plan. And our long-term vision is the establishment of a single access point for patients to access records and transitional services from a range of health and care organisations. So my Dorset Care Record is that system. A health and social care practitioner will be able to invite a citizen to set up an account to view their own records. Accessing the portal will enable individuals to have more interaction and involvement in their health and care. It will provide you and me with more choice and control about their care and how it's delivered. In addition, this work will enable improved access to services and records. And it's going to be rolled out to people in stages, beginning with specific groups of citizens. We expect outpatient clinician letters and discharge summaries from our acute hospitals to be the first pieces of information to be available through the portal. And we're also working on a health education library too. So clinicians and citizens will also be able to set goals such as reducing alcohol consumption, setting weight loss targets, and these can be reviewed by the citizen and the clinician, making it really interactive and a supportive process. In time, the portal will include information about all those involved in your support in Care Network, as well as including blood tests and possibly radiology reports and interactive patient forms to allow you and me to have a really meaningful conversation with the professionals involved in our care. So what we're currently doing is we're working with a number of representatives, so a number of groups, Dorset Carers Hub, the CCG Public Engagement Group, public participation groups, carers groups such as CRISP and the DHC Carers by Experience Group, and others as part of user testing for these 3 pilots. And we'll be looking to do more of that and further engagement events. And we'll provide updates for our social media presence, including a new Facebook site that's coming soon. Next slide, please. I just wanted another exciting thing in the future that we're involved with. We're also hoping to launch for our partner professionals at the end of the month a diabetes clinical pathway. There's estimated to be over 4 million people living with diabetes in the UK at present. That represents 6% of the UK population, or 1 in every 16 people having diabetes that's diagnosed and undiagnosed. So our diabetes pathway is based on a Northern Ireland pathway, which was rolled out as part of the country's National Share Care Record project, serving 100,000 patients. As I said, our diabetes pathway is due to go live at the end of November, and it will allow clinicians involved in the treatment of patients to access more accurate data when needed. And the system removes the need to re-enter data and allows information to be shared between trusts. In doing so, the system helps improve engagement between health professionals from different disciplines that perhaps sometimes have been left out. and ensuring that different places in the care system can be used to inform and improve the treatment of patients. So the new pathway also allows clinicians to factor in unrelated conditions into patients' treatment plans. And previously they had to use separate systems for paediatric and adult patients, and information could not be accessed from one trust to the next. So as such, information had to be re-entered, making it really difficult to record trends in patient conditions and making reporting back to a national scale really difficult. So all staff with DCR access will be able to see the diabetes pathway, but it'll be used predominantly by a multidisciplinary group of medical professionals involved in caring for patients with diabetes, including podiatrists, within the partnership. And we've had around about 50 staff so far from United Hospitals Dorset and Dorset County Hospital and Dorset Healthcare who have been given access for specific use of the pathway. And among the key things that it will do is it will allow consultants to be proactive in their care, providing a much journey for patients, increasing their confidence in the treatment plan, improving outcomes for patients in the long term, and patients only have to tell their story once. So I think the future is really exciting. The future is digital. The future is Dorset Care Record. Thank you very much.
I love that. The future is Dorset Care Record. That's a good way to end, Tony. So we've got a few people on the chat bar. Jane's put a massive thank you to both of you and all the effort and work that's gone into this, and it's been really interesting. Did anybody have any questions that they wanted to ask Tony and Catherine? Just give people a minute in case they wanted to. No. Oh, we might have one coming. Simon, if you wanted to put your mic on and speak, if that's easier, you're more than welcome. Oh, Simon said, very interesting. Thank you both.
Thank you very much.
No, he's too shy to come on.
If I could just interject there, I've actually I've got a link here for another one of those boards that I've done from the beginning. If anyone wants to just hop on there and just share with us maybe one thing that they can take away from today, something they learned from today they didn't already know about, that'd be really helpful feedback for us as an alternative platform to get some information back from you guys.
Or any advice that we can do in terms of engagement.
Yeah.
You know, around the citizen portal or my Dorset Care Record, that'd be great.
Brilliant, that's great. But this recording will be going out on YouTube and will be available for everybody. Oh, Deb's has come up with a question. So how has COVID impacted access to Dorset Care Record?
Well, shall I take that one, Catherine?
Yeah, okay.
I mean, talking to certainly to the acute hospitals, I think it's made a real difference in terms of records being accessed, because for a number of specialist staff, particularly who were used to meeting people face to face and not perhaps relying on records, they were having to do much more many more virtual conversations, and so therefore having to really rely on records much more. I don't think that was so much the case for pharmacists and stuff like that, who were still during COVID, the height of COVID and the first wave, and indeed now, going around the wards and speaking to people face to face, even though they are heavy users. But it's definitely made a difference in terms of numbers as well. So as I said, you know, before COVID, we were growing, but we were around about sort of the 5,000-6,000 records being accessed on a monthly basis, and now we're up to 14,000 and growing. So it is making a difference. And obviously, you know, we've talked about Yeovil and community pharmacies, and hopefully those two areas will grow too.
That's incredible. I mean, I saw the social media when you launched the access to pharmacies. I wonder whether, is that unusual to have access in pharmacies? Are we pretty unique in Dorset for that?
I mean, there are others around the country, certainly in the Thames Valley area. There are quite a few, they have quite a few accesses to care records, but certainly down here in the southwest, yeah, we are ahead of the game here, which is good. We've had other interest from other care records as well, you know, asking what we're doing. For example, next door in Hampshire are quite keen to do what we're doing.
It looks like Simon Simon's got another question for you. So do you think the various EPRs around the country will ever merge or integrate in the future? Now, that's a big question.
It is a big question, and obviously we have the pilot LACRAs, which are local health and care records. So we have the Wessex LACRA, which covers Hampshire and Dorset, and they have been working very closely in improving the interoperability now that Hampshire also have the Orion platform. And so that's the first step, is step by step, is that we get the Wessex talking to each other. So patients living in Dorset can be seen in Hampshire using the same sort of record. But then there's much more to do. So it'll be step by step, region by region. It will happen. I would never set a date on anything.
I think we learnt that from the national programme you referenced at the start, didn't we? Brilliant. Simon's just thank you. So can I just thank you both for the time that you've taken and being involved in the Festival of the Future. If you haven't signed up for any sessions tomorrow, there's lots more available this afternoon and tomorrow. So don't feel like you're missing out. And all the recordings are available on the Digital Dorset YouTube channel and all through the Festival of the Future web pages. So can I just thank everybody? Oh, I've just pasted in the wrong link into the chat, but thank everybody for their time this morning, and I hope you enjoyed it and found it really interesting.
Thank you. It was.
Thank you very much. Thanks for listening. Thank you.
Thank you.
Thank you.
Stop recording.